Certainly, here's the intro narration in English.
Today we're breaking down
Master inflammatory bowel disease and ace your nursing exams.
one of the most tested gastrointestinal topics in nursing school. A lot of students confuse Crohn's disease with ulcerative colitis, but by the end of this lesson, you'll know exactly how to tell them apart using cues, complications, and clinical reasoning. We'll cover what inflammatory bowel disease is Crohn's disease, ulcerative colitis, key differences, major complications, high-yield NCLEX clues, and practice questions with rationales at the end. Grab your notebook, your coffee, and let's lock this in. Inflammatory bowel disease is a chronic inflammatory disorder of the gastrointestinal tract. The two major types are Crohn's disease, ulcerative colitis. Even though they sound similar, they affect the bowel differently. The cause is not fully understood, but several factors are linked. Autoimmune dysfunction, genetic predisposition, environmental triggers, abnormal immune response to intestinal bacteria. IBD is not the same as IBS. Important, IBD, inflammation and tissue damage. IBS, functional bowel disorder without inflammation. That distinction matters. IBD causes actual destruction to the bowel tissue. Crohn's disease can affect any part of the GI tract. Most commonly, terminal ileum, small intestine : key, phrase, skip lesions. That means diseased areas are separated by healthy tissue. Crohn's disease causes deep inflammation. Transmural damage, transmural, means the inflammation goes through all layers of the bowel wall. That is why Crohn's disease causes fistulas, abscesses, strictures, obstruction, common symptoms, crampy abdominal pain, diarrhea, weight loss, malnutrition, fatigue, fever. Pain is often in the right lower quadrant. Why? Because the terminal ileum is commonly involved. Stool characteristics, usually non-bloody diarrhea. Blood can occur, but it's less common than in ulcerative colitis. Nutritional problems. Crohn's patients commonly develop vitamin B12 deficiency, iron deficiency, protein deficiency, because nutrient absorption becomes impaired. NCLEX. Clue, if you see fistulas, cobblestone appearance, skip lesions, malabsorption, full thickness, inflammation, think Crohn's disease. Ulcerative colitis only affects the colon and rectum. Unlike Crohn's disease, the inflammation is continuous and there are no skip lesions. It begins in the rectum and moves upward. Key difference. Ulcerative colitis affects only the inner lining of the bowel, not the full thickness. Main symptoms include bloody diarrhea, mucus in the stool, abdominal cramping, urgency to defecate, and tenesmus. Tenesmus means feeling the need to have a bowel movement even when the bowel is empty. Pain is usually located in the left lower quadrant. A major complication is toxic megacolon. This is life-threatening. The colon becomes severely inflamed and dilated. Signs include fever, tachycardia, severe abdominal distension, and decreased bowel sounds. This is a medical emergency. NCLEX clue, if you see bloody diarrhea, continuous lesions, colon-only involvement, or toxic megacolon, think ulcerative colitis. Crohn's disease, anywhere in GI tract, skip lesions, full-thickness inflammation, fistulas, common malabsorption, common cobblestone mucosa, usually non-bloody diarrhea, ulcerative colitis, colon and rectum only, continuous lesions, surface inflammation only, bloody diarrhea, common toxic megacolon risk, higher colon cancer risk. If you see fistula abscess, cobblestone appearance, malnutrition, think Crohn's disease. If you see bloody diarrhea, toxic megacolon, colon involvement, only think ulcerative colitis. Another major NCLEX point. IBD flare-ups can be triggered by stress infection, smoking, certain foods, especially smoking in Crohn's disease. Crohn's complications, bowel obstruction, fistulas, abscesses, malnutrition, and perforation. Ulcerative colitis complications, toxic megacolon, severe bleeding, colon perforation, and increased colon cancer risk. Patients with long-term ulcerative colitis need regular colonoscopy screening. Question 1. A nurse is reviewing a client's chart. The client has skip lesions, fistula formation, and full-thickness bowel inflammation. Which condition does the nurse suspect? A. Irritable bowel syndrome. B. Ulcerative colitis. C. Crohn's disease. D. Diverticulitis. Answer C. Crohn's disease. Crohn's disease is characterized by skip lesions and transmural inflammation, meaning all bowel layers are affected. This increases the risk for fistulas and abscess formation. Question 2. A client reports frequent bloody diarrhea and left lower quadrant abdominal cramping. Which disorder is most likely? A. Crohn's disease. B. Ulcerative colitis. C. Appendicitis. D. Peptic ulcer disease. Answer. B. Ulcerative colitis. Ulcerative colitis commonly presents with bloody diarrhea and continuous inflammation of the colon and rectum. Question 3. Which complication is considered life-threatening in ulcerative colitis? A. Fistula formation. B. B12 deficiency. C. Toxic megacolon. D. Kidney stones. Answer. C. Toxic megacolon. Toxic megacolon occurs when severe inflammation causes paralysis and dilation of the colon, increasing risk for perforation and sepsis. Question 4. A nurse teaches a student about Crohn's disease. Which statement by the student indicates understanding? A. Crohn's disease affects only the colon. B. Inflammation occurs continuously. C. Crohn's disease may occur anywhere in the GI tract. D. Bleeding is always present. Answer. C. Crohn's disease may occur anywhere in the GI tract. Crohn's disease can affect any part of the GI tract from mouth to anus and is characterized by skip lesions. Question 5. Which assessment finding is most associated with malabsorption in Crohn's disease? A. Weight loss. B. Hypertension. C. Bradycardia. D. Hematuria. Answer. A. Weight loss. Inflammation in the small intestine interferes with nutrient absorption, causing weight loss and nutritional deficiencies. Inflammatory bowel disease is one of those topics where pattern recognition matters more than memorization. Remember, Crohn's equals skip lesions and full-thickness damage. Ulcerative colitis equals bloody diarrhea and colon-only inflammation. Master the clues. Master the complications. And the NCLEX questions become much easier. If this lesson helped you, make sure to subscribe to RNS Study Room for more high-yield nursing content designed to help you pass nursing school and the NCLEX. See you in the next lesson.